Luczak. I'm a certified pediatric nurse practitioner in primary care and a pediatric mental health specialist. I got involved in the health freedom movement in July of 2021 when a friend of mine that I was talking to on the phone who's an OBGYN, was on his way to a secret meeting of medical providers who had concerns about mandates. And I actually asked to go, and he let me go. And I met other providers that were concerned. At the time, I was not subject to any mandates for vaccinations, but my patients' parents were, and they were very concerned because of a coercion that they were feeling in regards to being bribed to take the vaccines and not having their choices about their own health decisions. So I went to listen to other providers, and I also wanted to meet other healthcare providers that were actually treating COVID with early treatment protocols. Then I was asked to go to a brainstorming on what we could do, and I encouraged providers to use their voices as medical providers, because my patients and their families, their parents, didn't have a voice, they didn't have resources, but they trust me and spoke up to me about their concerns of coercion. And this was in July of 2021. And so at that second meeting, I did encourage the doctors that were present to file a lawsuit against the hospitals that were mandating vaccination for their staff. So I found myself a default leader in this group, mostly because I understood and was suggesting the psychological issues at play, where I felt like we couldn't communicate well, colleagues, like some medical doctors with other medical doctors or nurse practitioners or physician's assistants. It felt a lot like our colleagues were almost brainwashed, but not really. And the feeling was kind of similar to what you see when you have at a dinner table with family members that maybe are very Democrat, very Republican, and they're not even able to communicate with each other. And so, but doctors are used to speaking in certain ways, or nurse practitioners or medical providers in general are used to communicating with each other in specific ways that are not fundamentally emotional. And so I tried to gently encourage the providers there to focus on the reality that we're dealing with an emotional reaction, an emotional response in our colleagues that are adherent to mandates and protocols that appear to some of us to not be in the best interest of our patients, and yet we're unable to show data, we're unable to talk rationally about our concerns. And I think that had to do with an emotional or moral even response, which kind of justifies your actions and participations in these things. And so that then led me as a leader behind the scenes. And as we progressed, some of my concerns started developing, and I was aware at first of, I heard a podcast by Jonathan Haidt, who's a social psychologist out of New York University, talking about the pandemic response. And it made a lot of sense to me when he talked about the biological responses to adversity that we have in our psychology of threefold things. And at the time, we only had two present, he said, but I think it's going to ring true to you. And these are things that are deeply ingrained in our physiology, in our psychology, in a neurobiological way. And there's three. And so the first one that I'm going to say first is a plague response. So these are things that our ancestors for a long time, I'm going to say hundreds of thousands of years, but a long time, have been, when you recognize plague, you kind of like have disgust. That's a plague response. You kind of want to, they have sores, especially with sores or rotting smell. And then there's a scarcity response in times of scarcity, famine response. So we hoard in times of scarcity. And then there's a complex response that's the result of hundreds of thousands of years of tribal warfare and this type of adversity that's not from famine, not from plague, but from other humans. And that's very complicated, but what I call it is the enemy at the gates response. What Jonathan Haidt called it is the response of together, like gathering together. So you gather together in response to the tribe threatening you. And that we began to see more of that in 2021 as things were progressing. And it became very worrisome to me that the medical professionals were partaking in these responses instead of necessarily using our training to respond to an emerging pandemic that we don't know a whole lot about, or we know as we're learning a lot, but if we don't adjust and learn, we'll never respond well. So what I thought was, we're kind of in a process where a lot of our colleagues were being brainwashed or being the result of this constant propaganda type thing where we're being told specific protocols or specific formulas, just like everybody else in the population, to be afraid of certain things, and then we are given specific responses and interventions to do. And it's kind of similar to what you all have had with face masks and things and social distancing. We have those same things as medical providers. And then I came across Matthias Desmet's, who's a professor at Ghent University, his work on totalitarianism and his concerns that we were in a mass formation in kind of like November of 2021. And I thought that made a lot of sense to me because I also had observed clinically in my role as I'm a developmental behavioral specialist, so I see a lot of kids with needs for very challenging psychiatric issues, very sad, broken kids. I see the results of fractured families and fractured society, and kids needing to have psych admissions, and kids not having access to any type of meaningful service sometimes, because I care for really underserved populations in the US. And so when Desmet's 4 points that he talked about, he said there's 4 precursors, and these are the most important things to understand what's happening, is there's a lack of community, of deep social connections. And there's a loss of meaning and purpose. And then there's when you have that widespread in society, and his theory, which I agree with, is that these conditions existed before the pandemic. It creates individuals, when they experience this, there's an anxiety that doesn't have an object. And we're very quick to be negative in our emotive responses to everybody or anything. And that process, if you have either spontaneous or intentional propaganda that focuses everybody's attention at once, I say terrifies everybody to focus on one thing to be afraid of. Because that's really what we want. We want to know why we're having these anxiety feelings. So you focus on that one thing, and then you will have a belonging with other people that are also doing that. And if the propaganda also, and please forgive me for saying propaganda, that's kind of what totalitarian psychology depends on, and I believe there's a lot of explanation as far as what we've been seeing. But if the propaganda also gives you specific tasks to alleviate the terror that's instilled in you, then these rituals mark you as belonging. And then there's an othering of those that don't belong in your group. And that's that dangerous tribal biological response that I was observing or afraid of that. And I experienced that tribalism a lot in my community, working with the poor in Louisiana. So for me, when the mandates came up and the governor decided to mandate that children have to receive gene therapies in order to go to school, mandatory. I mean, these things are limited in their studies. We don't know a lot about the long-term safety effects. We have limited data on the efficacy based on strains of this virus that are many, almost years old, but many months old, year and a half old at this point. We've not had a lot of transparency about the process of approval or the process of the testing, and we're gonna mandate that kids have to have it, which also flies in the face of what my patients were experiencing, which was that these vaccines are not effective. So my patients were concerned, the parents were concerned that they see like their grandma or themselves, they got the vaccines and they were told that they would be protected, and then they got COVID, and now they're being told that they have to vaccinate their kids or they can't go to school. And that flies because their kids will then be safe, right? Because these vaccines are safe and effective. But it flies in the face of common sense because they've gotten the vaccines, and at least in Louisiana, a lot of my patients' parents got sick. Now there's some that didn't, and they had positive experiences, and that's great. I'm talking about maybe the other ones in my clinic that didn't feel that way, right? And so what we did was the group, I reached out with a bunch of other medical doctors that had been concerned, and we decided to go and speak at the state capitol and show up together. There's probably 19 or 20 of us that went, and we were just there with, it turns out, we were expecting to be pretty much alone, and then there were like hundreds of other people that came too. And there's literally a stack of hundreds of cards against this mandate at this hearing, and one card for it of someone that didn't speak. And then we were there, and we've been doing the research and reading the research articles on what actually is said by Pfizer about these vaccines, what actually is said by the companies to the FDA in the studies that we're quoting. What we say when it's safe and effective, we're quoting a study from 2020 that found the vaccine to be safe and effective. And then the follow-up studies to that, which is, it's all kind of the same process. But it doesn't necessarily, it's a little bit dishonest because it doesn't necessarily apply. Like right now, this is February 2022 when I'm filming this. We just got over this third, now called Omicron wave of COVID-19, and the vaccines were very ineffective. I'm vaccinated. I'll share. I'm vaccinated. I got Omicron right there with, family members that are not vaccinated. We all got it together, and we all had similar efficacy in terms of I wasn't better off. I just got the same thing they did. And so then but we're able to say it's safe and effective because of the research from 2020 against a lot of strains ago. And then we hear the director of public health of the Louisiana Department of Health, this doctor, going and giving testimony. And really, at the time, I was very for vaccines, and I am very for vaccines. I'm a pediatric nurse practitioner because my son, when I was like many years ago, my wife and I, we had our firstborn, and my sister has developmental disabilities, and we were concerned because at the time there was research that was linking vaccination to autism, and it was just a little study, but we wanted to kind of like, well, let's wait and see. And we were also foreign missionaries, and my son ended up getting really sick of a vaccine-preventable disease, and we were in Mexico, and they actually sent him home to die, because that's kind of what happens there. And he lived because my wife was breastfeeding him, and followed we had a little manual about breastfeeding, but it was called rotavirus, and he just threw up nonstop. And now in America, we probably would have had a way to hydrate him, but in developing countries, they don't have those resources, and he was just sent home to die. He weighed less at 9 months old than he did at 6 months old. And so he got really sick. He lived, but I was like, wow, there's something to vaccines. There's some benefit. And so I'm very understanding of people that have hesitancy with vaccines, but for my wife and myself, the reason I'm a pediatric nurse practitioner is to help vaccinate people, kids, to prevent these diseases that I experienced in my own life and family, to help people to have these vaccines. But it's so important to be honest and forthcoming about what we know and what we don't know, and what the risks are and what the unknown risks are. We just don't know. And to say to a parent that we know that this thing is safe when we've not done the 8 years of safety data, and we have very limited animal studies. The animal studies that were available publicly with the FDA documents that I saw had to do with antibody titer responses, mostly. Just checking to see if the animals popped a titer and could react to the vaccines, which is different than a whole panel of studies that I'd expect to see. When we gathered together, we actually planned on the different doctors to testify on different things, and I was asked to testify on mass formation because I'm the only one that knows anything, I guess, about psychology really, or uses it. I use it a lot, I just see a lot of stuff that shouldn't be happening and try to figure out what's going on. And so I gave a testimony on mass formation on December 6th, and I found that, well, I was expecting to have some repercussions. All of us were that went to talk. So as a nurse, part of my training was that to be a nurse is to, as a nurse, part of my training was to help your patients have their voice heard, to help them to have a platform to have their voice heard. And if they can't do that, to speak and help on their behalf to have their voice heard, to advocate for them. And so that's been my intent, is to speak on behalf of my marginalized, mostly marginalized by any socioeconomic standard or any other standard population I serve, and the very concerned parents and grandparents that care for my patients. And I deal with I have a lot of autistic patients I provide primary care and specialty-ish care for, and they're young, some of them. And when I found out that Joe Biden, the current administration, had mandated that children from 2 to 5 wear masks in Head Start settings, that was really troubling to me. And then I was asked, actually, by somebody else to write a little statement on it. And so I did. I wrote a declaration that it's a bad idea to mandate at a federal level that 2 through 5-year-olds and their caregivers and Head Starts have to wear a face mask, or the Head Starts wouldn't be funded. And I wrote that because I'm caring for kids that have issues with like autism, and they need to see people's faces, and they need to see their peers' faces, and they need to see their caregivers' faces, as well as normal, healthy, typical developing children in this age. Children learn from 0 through 7 by mirroring faces, and they learn emotive responses, they learn to recognize emotions, and so to put children in the absence of seeing their faces for 40 hours of their waking time a week is really concerning to me, that we're going to see an increase in developmental delays. And if this continues for a long time, it really runs a risk to being lifelong, because our brains develop in windows, and if you don't have the environmental exposure to learn the positive social and emotional interactions, you end up not learning them easily later on. Like childhood is like a house. So the brain is kind of like, I tell people it's like a house. So you have a foundation that you lay, and that foundation you build everything else up on, and that's what infancy is. Infancy is like that foundation. And then being a toddler and school age or early school age, but mostly toddler, is, I say, like building the sticks in place. And then, you get the the teenage years, you know, put the shell around, and then in the young adulthood and up till 40 is a time where you finish the inside. And then once you're 40, that's the end of human development, sorry. Like, then you just get to mature and enjoy life because you made it through. But yeah, that process, so I wrote that declaration, and then there were I think people noticed because I had several different threats to me from different people to be silent, not talk anymore, or that I would have my license taken away because I don't know, I was saying anti-vax stuff. I'm not saying that these vaccines kill people. I'm not saying that I don't know that. Other people that I trust have real concerns, but I don't have direct experience or knowledge on that. I speak about the things I have experience and knowledge on. And so when I was asked to come here, by the time I was a little concerned, because this is well, you know, I thought this was about, there's a lot of people that are involved in the health freedom movement that are kind of truly anti-vax, it seems, right? Or that's what I thought. But then you find out that there are some, but there's a lot that just want to have, you know, want to know more, want to have actual data supporting decisions that they make for their families, or be able to make the decisions of what they do with their kids based on what they think is right. And I think we all feel that way. And so I felt like speaking here was an important thing to do and a good opportunity. And I wanted to share because it's interesting. Sometimes I've talked to some pediatricians and they're, you know, they share how some of the pediatricians almost push these vaccines, these COVID vaccines, and I think it's analogous to what's happening in other parts of medicine because it is set that way by the policy, by the FDA, by the national organization, by the CDC response. And for us as providers, well, if what the data that they're saying doesn't support the facts, the plan that they've made. So if the facts don't support the statements that are being made, if you look at the facts and the data, and they're telling an untruth in a deceptive way for a public health purpose. And I know that that happens because I went to a very fancy school, and some of the public health underlying philosophy is that the ends justifies the means in regards to public health policy. And individuals don't always act in their own interest, and they definitely don't always act in the interest of the group. And so this maybe at the time minority, but there's an attitude where it's okay to deceive people in order to get people to act in a way that you deem is appropriate for the group and for themselves, or for themselves. I would hope for themselves. And that's basic medical ethics, that you need to always act in the patient's best interest and never act against the best interest of the individual patient for the sake of some study or some group intervention. But you could easily sidestep that principle of Western medical ethics if you focused on the end of the group. And we've seen that a lot with the mass formation. So for me, this is I try to have a lot of patience and a lot of, I'm okay with my colleagues that are doctors or nurse practitioners or PAs that are uneasy or maybe know that this might not really have all the evidence there, because what's the other option? I mean, if they've lied to us about this, what else have they lied to us about? And we're busy people taking care of our families and taking care of our patients, and we need to trust somebody and some set of protocols and guidelines to order and structure what we do. And when you take that out, you end up very uneasy, because what's left? So, and then I've had talks with pediatricians that have said that that's what they have heard from their colleagues about why their colleagues cannot change the course from the vaccine narratives or whatever you want to say, from because they can't let go of the structure of their daily tasks working to care for patients. Because the other option is for each of us to be stuck alone, having to do all the research with all the primary articles for every patient that we see. And that's a major big problem that's happening. And I figured that would be something to share, because so be patient with the doctors and nurse practitioners and physician's assistants or whoever the providers that are having less tolerance. So one of the concerns that I had with totalitarianism psychology is the fact that my grandma, growing up, she would share with me her experiences in surviving the Holocaust. And she was a little girl in Poland, and then the Russians invaded her part of Poland, and she had to repeat like 2nd or 3rd grade in Russian. And the Russians treated our people so poorly. They randomly tortured people and did things I will not say on this, but you can, if you want to read about it, you can read Solzhenitsyn's Gulag Archipelago to read some of the things that happened. And then the Nazis came in and invaded, and she had to do 3rd grade again in German. And then the Nazis were retreating, and they gave a choice for my ancestors, her parents, to either get in the cattle car and go to work themselves to death, or stay there for the Russians. And my great-grandfather got in the cattle car because he felt like it was better to go to a Nazi death camp than stick around for a socialist communist state. And my grandmother worked as a slave attached to Dachau on half-starvation rations for 3-ish years until the liberation and the Allied forces came through. And she always taught that it's so important to not treat other people the way that they were treated. So what do we do with all this? Well, what I've been encouraging people to do is to look at and think about the underlying conditions that led to this state of anxiety that opened us up to this mass formation, or whatever you want to call it, and to be patient and loving with each other, to not activate these pandemic or adversity responses that we have biologically. So to be aware of that and to not respond with disgust, aversion, or other, our neighbors, friends, or people that we disagree with, even if they treat us that way or you that way. It's important to not respond in kind, and to really, I encourage people to seriously reconnect with God. And one way to do that is through your faith community, and to form deep social connections with your extended family, with your family, and with your neighbors. And these connections, it's really important, have to happen in person. Because while I'm not able to see all of you with this virtual summit, it's really important biologically for humans to have in-person relationships and connections. I really wish I could meet some of you that are able to listen to this talk today and these other talks, but maybe one day we will. I hope that you get something out of what we had to share.